Assalamu alaikum, greetings of peace. I want to welcome all of you to today's webinar, which focuses on how to best support Muslim essential workers during the spiritual season that is coming up very soon with the month of Ramadan, which starts on April 13th this year. As we enter the second year since the start of the COVID-19 pandemic and all the changes it has brought into our daily lives, we will be speaking with three Muslim panelists who represent some of the most important fields for essential workers who have been on the front lines of keeping us healthy, safe, and well-fed during the pandemic. They include Dr. Hassan Shanawani, a physician in the state of Michigan who presently serves as chairman of the Board for American Muslim Health Professionals, which has been at the forefront of educating Muslim American communities about best practices during the pandemic. Lieutenant Yusuf Shansab, who serves as a commander in the Union City Police Department here in the San Francisco Bay Area, and Hazem Tabahi, Vice President of the Pita Inn chain, a landmark in the greater Chicago area since 1982 with multiple locations. Welcome. Thank you all three of you for being here and joining us today. For our audience, make sure to stick around until the end as we will conclude the panel by sharing two resource handouts, one for Muslim employees and one for employers, make sure to look out for those. Now, let's get started with getting a sense of the impact the pandemic has had on all of your professional lives. Dr. Shanawani, we'll start with you. Can you give us a brief day in the life of what it's been like to do your job during COVID-19?
Assalamu alaikum. Can you guys hear me?
Yep.
Yeah. So I have two roles that I do. One of them is I work for a large Medicare Advantage insurance plan, and then of course I'm a practicing lung doctor and an expert on ventilators and ICU care. And I think it's easy to say it was about a year ago this week, honestly, when we really began to recognize the immense tidal wave that the COVID pandemic was. And really it was, I mean, just everyone was overwhelmed. I mean, there's really no way to describe it. The nurses and doctors, I remember speaking with doctors literally on their knees crying just from all of the patients that were coming through the ER, just so many sick people. Likewise, the government and Medicare was trying to respond to the need of taking care of all of these people. And hundreds, we were normally on a busy week, Medicare will put out maybe 5 or 10 changes a week. We were getting 10 to 15 a day from Washington, D.C. to keep up with all of the new challenges. And then, of course, this was really an immense threat. I mean, there is no one in the country, unfortunately, we've had over 500,000 people die from COVID. There are very few people in America who don't know someone who wasn't affected. And even one of the first deaths I remember last year was my own nurse, a nurse who took care of veterans at the lung clinic at the Detroit VA. And literally weeks before she was scheduled to retire, she passed away from COVID. And COVID took so many people, friends, loved ones. It's been devastating. And then, of course, most importantly, ING, myself, AMHP, a number of organizations came together. And of course, our deen is inherently a social religion. It's the word ad-din al-jama'a, and we had to make a decision, really around this time last year, to advise masajid to cancel Jum'ah, to cancel congregational worship. And as we were getting ready for the most important month of the Muslim year, Ramadan, telling them that the essential, the heart of Ramadan, breaking fast together, praying together, all of the social aspects were all going to be put aside. I mean, that was just, it tore our heart out. I will tell you, Ramya, I was physically sick when we had to put out the statement last year, which ING signed on to, advising masajid to close Jum'ah. And I never in my life thought I would hear this adhan, instead of, hayya as-salah, as-salatu fi buyutikum, make your prayers in your homes. Around the world, billions of Muslims were being advised, stay away, stay away. The jama'ah of our deen was taken away from us by this pandemic, by this disease. So, I gave a long answer and I apologize. We have two other guests, but just on so many levels, I mean, this affected me and everyone that I know.
No, absolutely. I mean, we're here to talk about this, and thank you so much for sharing such painful experiences, I think it's really meaningful for all of us to learn. If we're not in the healthcare field, we don't like we can maybe guess what it is the doctors are experiencing, but to like really hear it is very powerful. So thank you very much for sharing. Next, we turn to Lieutenant Shansab. If you can also give us an idea of like your brief day-to-day life in your role during the COVID-19 pandemic.
I just kind of piggybacking on what the doctor just mentioned. Muslims are, it's a social religion, and my profession, law enforcement, is also a pretty social profession. Not only do we go out and talk to people in the community and deal with them on a personal basis at some of their most toughest times, but our organization, our employees, we use each other for the issues that we may have, job related and family related. And this past year, we've had to implement a lot of new changes, social distancing within the police department, social distancing outside of the police department. When we go to calls for service, having to wear masks. So dealing with the people in the community, we haven't been able to have that personal service. And then amongst ourselves, not being able to eat lunch during lunch breaks and talking about some of the things we deal with, not being able to socialize, not being able to have coffee together, not being able to talk about some of the calls we go to where only we know what we deal with and how to respond to it and make ourselves feel better about it. So it's been tough for our employees. I also manage our wellness program for our organization, and talking to some of our supervisors that manage that program, and even having personal conversations with some of the employees. It's been tough for our employees. I know I've had to go, as we talked about before this meeting started, some funerals with family and friends, and I'm sure other employees have as well. We've had employees that have lost parents. We've had employees that have lost loved ones. So it's been difficult for our employees as well.
Thank you so much for sharing, Lieutenant Shansab. And then also now we will hear from Hezem. Please share a day in your life in your role through the last year of COVID-19. Oh, and you're on mute.
Obviously, it's been difficult for everyone to deal with this pandemic. Restaurants are obviously considered essential places. Our dining rooms had to close, but we still had to provide takeout service. What you have to deal with during the pandemic is, for example, we have 160 employees in 7 different locations, just managing the safety of the employees and the customers, which is extremely difficult. Making sure employees don't come to work sick, telling them that we will pay you, don't worry about your hours, just stay home if you're not feeling well, otherwise you'll get other people sick. In terms of customers, dealing with the paranoia of everyone. If another customer standing next to you, another customer, they'll get upset with each other. Dealing with people just on a daily basis that are just scared all the time. And for the restaurant business, you kind of had to pivot to providing takeout, curbside service. There's obviously no dine-in for months and months. Sure. So you had to change the way you do business. Yeah. Just handling, all the different people's needs. And it's just been really difficult. The restaurants had to just change the way they do business. The ones that couldn't change, unfortunately, had to close. Yeah. So you just have to rely on takeout, keep everyone safe. The hard thing has been like monitoring employees, make sure they don't stand next to each other for too long, or they don't take their breaks next to each other. For example, I would have my employees sit in the dining room, everyone at a table like 10 feet away, not eating together. You have to keep enforcing that, so just constant monitoring of every situation, make sure everything is sanitized, make sure people are sanitizing their hands. Yeah. Common areas are maintained. Customers are spaced out. Some customers don't care. Some don't wear masks, dealing with anti-maskers that don't want to wear a mask when they come into your store. So there's just been a lot of those issues that, other than just the business itself, that you have to deal with. Yeah. So just a couple of things that we had to work with in being in the restaurant business.
Yeah, no, absolutely. Thank you so much for sharing. Thank you all so much for sharing your experiences. Just to go into it a little in more depth, what is something that you don't see that's commonly discussed in the news or online about your job, how your job has changed? Of course, there have been many articles talking about essential workers, in different sectors or overall, and how this has affected them. What is something like you wish that you would see discussed more often, or you're like, why isn't this being discussed? This time we'll start with Lieutenant Shansab.
Well, unfortunately, our profession's in the news a lot. It's
Mm,
almost constant. It's been over the past few years, and last year with Floyd and everything else
mm,
going on, we've been in the news even more so. But some of the things that I would like to see discussed, and you see it a little bit with certain news channels, is how it's affected law
mm,
enforcement profession, and the people that strive to be in this profession.
mm,
I think it's changed. If you look at the numbers, less people are applying for work to get into public service as law enforcement professionals, and less people desire to want to do it. And I think the media and everything else definitely has an effect on it. And I'm talking just in general terms on a grander scale. On a more narrow scale, as far as how COVID has affected our
mm,
profession, people don't realize we've had to cancel everybody's vacation and everything else. And I'm sure that's not a big deal because I'm sure most other people cancel vacation, but we've also made our employees be available for service at any time. And we've called people in. So when we had people that got sick with COVID, other people had to come in. So it was constant on the job. If you're not working, you got to be ready to come into work because you're a first responder. So
yeah.
this past year, that's how it's been. Be ready to come in at any time. You could be called in. So people had to get approvals if there was a death in the family, or if there was pre-scheduled family reunion or anything like that. We had to get all those approved. We've had to cancel vacations. We had an employee and his partner and family members who had spent over $20,000 on a vacation with multiple family members that had to cancel it, and they weren't going to get refunded for it. So it's affected a lot of things in that manner.
Yeah. Wow. 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 Thank you for sharing. Next, can we hear from Hazem, please?
Yes. Like I said, it's been well documented what restaurants had to go through, but some issues that maybe are not seen is that every day you don't know what level of business you're going to get. You don't know how to schedule people. Saturdays and Sundays, or when it's really busy or not busy. Some Mondays are busy. So it's just been difficult scheduling, not knowing how much business you're going to get each day. Finding employees. A lot of employees chose to go on unemployment, even though we let everyone work. In our business, we didn't lay off anyone. Even our bus boys in the dining room, when the dining rooms were closed, I just had them clean. I had them help with other things just to keep them on the payroll. But some employees, they chose, to go on unemployment, to take the unemployment check, which is fine. So just hard when things improved a little bit is to find people to help out. So one big issue is just dealing with certain times large volumes of customers that want their food quickly, and they're all, like I said, paranoid and want to get in and out, and you're just trying to do your best to accommodate them. We've had issues with supply chain in terms of everyone heard like the meat packing plants, back last year when all of them shut down because of COVID. So meat prices within a week went, double and triple the price.
Yeah.
So dealing with, and you can't just change your price in the restaurant daily. So just sucking up a loss, for a few weeks, hoping it'd go down. That's been challenging because you don't want to keep raising prices to your customers. And also, like I said, just monitoring everyone's safety and employees and separating them. This has always been an issue. So it's not, just been difficult, just not knowing what to expect each day, like in everyone else's field. So it's a challenge.
Yeah, no, absolutely. And honestly, something that's coming up for me is I've seen in my own like news feeds and stuff like that, people talking about how just generally people are more on edge. People are more short-tempered. I know I personally have been more short-tempered in the last year because we're all just so stressed. As Lieutenant Shansa mentioned, right? Like it might sound like, oh, it's a pandemic. Are you crying about your lost vacation? But that's time away to like relax and get yourself some time to breathe from stress of everyday life, right? So I'm sure as law enforcement and then working with people, like retail is like chronically known for people who are just like bad tempered with entry level employees. Anyway, something that's coming up for me with what you guys are talking about. Dr. Shanawani, also for you, what is something that you don't think is necessarily discussed as much about healthcare workers as essential workers?
Sister Rahma, you took the words right out of my mouth. I think I mean, if I'm just going to say these two words, and I think they'll ring with everyone who's watching this webinar, and my co-panelists, Lieutenant Yusuf and Mr. Hazem. Mental health. I mean, you were talking about it on edge. When you talk about the uncertainty that your restaurant workers, Hazem, are talking about, Lieutenant Yusuf, I have to believe that you've responded to hundreds of calls of people, right? And we don't know how to do with that. I mean, we've been blessed in this country, many of us, and you know, I have tremendous privilege that I'm able to move my work and my operations to my home. I have the space. Alhamdulillah, I'm wealthy enough that my children are able to work from home. People don't realize that. I mean, we think of COVID as this disease that affects your lungs and puts you in the hospital and on oxygen and on a ventilator, and you need these medications. But health is social and spiritual and physical well-being and mental well-being. And COVID stole all of that from us. It stole it from everybody in this country, all 300 million of us, and everybody across the world. And when you listen to what everyone's saying, you know, what you were just saying, Sister Amma, about just being on edge, that's mental health. And I will tell you, I've not shared this with anyone, but I'm going to share it now. My own family, I've had children that were hospitalized for mental health issues, and I've had to, you know, to the point where, I mean, you know, police have had to get involved because of the severe damage to the mental health of my own children, my own family, with this. And it's really, I don't know how to describe it other than it's devastating. And I will tell you, when I was volunteering just 2 days ago, giving out vaccines at our local mosque, and I did not recognize, we vaccinated 300 people in one day at the mosque. It was incredible. But let me tell you, and it wasn't just a Muslim thing. It was open to the public. It was at our activity center. I will tell you, just seeing people outdoors, even if it was just to get a shot, I will tell you, just seeing that and being able to work, you know, provide community service and work at the masjid, and seeing my fellow congregants, some of whom I haven't seen in weeks and months. I haven't seen my own dad, who's older and has his own health issues, for 9 months. It's been almost a year. He lives in New Jersey. I live in Michigan. And so that's been an enormous challenge. But again, mental health. AMHP, we have a whole first aid mental health. You know, Lieutenant Yusuf, I'm sure you have training in how to respond to mental health crises. Our phone is ringing off the hook. We cannot do our mental health training that AMHP does fast enough. Just we do not have the hours in the day for Muslim schools everywhere around the country. COVID didn't just steal our supply chain. It just didn't take us away from eating at restaurants, right? It's not just about losing those 2 weeks of vacation. It's about exactly that, being on edge, that terror that comes with the uncertainty. But, you know, alhamdulillah, you know, I say all of this, but we are at a blessed point where I really genuinely believe that better days are coming. Spring is coming, inshallah. You know, just like in Surah Duha, you know, just the darkest time comes before the dawn, literally. Better days are coming, but we will have to unravel all of that damage to people, to our community's mental health. I think when you hear people talking about they don't want to mask and they don't want to do these things, honestly, half the time I really wonder how much of that is their own inability to cope. I've had those days too where I don't want to wear a mask, but let me be clear, I wear one every time, so that we're clear. But you just get tired of it, right? I'm tired. I want to eat in a restaurant too. I'm tired of carry out. I want to eat at Hazem's restaurant, right? I want to sit there with my family and my friends and enjoy myself. It's these things, they chip away at your soul, at your iman, at your spiritual. It's painful.
Thank you. Wow. Thank you so much for all of that. And honestly, for your intense vulnerability with sharing your own personal family struggle. I think it's really powerful. Sorry, just a tiny side note about mental health, especially in the Muslim community. The more we can make this a non-taboo topic, the more we can seek help. And honestly, if anything, because, you know, mental health issues are going to be probably pretty universal after COVID, Muslim or not, maybe that will help us, you know, not feel as, you know, I don't know, hesitant to reach out for help, because I have mental health problems, you have mental health problems. We all need to be active to to heal after this.
There's no shame in asking for that help, right? And you know, whether it's your service people Hazim that see it because they're on the front lines, they're on the receiving end of it, or some Lieutenant Yusuf, I'm absolutely certain you've been called to stuff. How many crises that are really just decompensating people that they've reached their breaking point. I mean, we could talk for 2 hours. We could talk all day about the mental health needs that have been aggravated by COVID. But, you know, I mean, like I said, I've never seen doctors cry the way I've seen doctors cry in the last year, or nurses. It's really something. I've never seen it before.
So let's feel the weight of, you know, the reality of what we're talking about, but also because we're here to talk about Ramadan, I'm going to transition us into bringing in COVID against essential workers and now bringing in the Ramadan aspect of things. So now, as we approach the second Ramadan during the pandemic, I would like to provide just a brief overview of this special month for those who are with us who may not be familiar with it. Ramadan is considered one of the holiest months of the year for Muslims, in which they fast from food and drink during the sunlit hours as a means of drawing closer to God and cultivating self-control, gratitude, and compassion for those less fortunate. The fast begins before sunrise and ends at sunset, when Muslims will break their fast and then eat dinner. During the month, Muslims also spend extra time reading the Quran and performing special night prayers. And as our panelists also mentioned, is usually a time of a lot of community social events, which of course with the pandemic, the first year and now this year as well, that is going to be either completely eliminated or greatly reduced. So now let's look at how Ramadan impacts essential workers specifically in our panelist professions every year, and then how this year offers unique challenges during the pandemic. So this time we'll start with Hazem, please. So how is working as a Muslim in your field impacted by Ramadan every year?
Well, in the restaurant business, people a lot of times ask, and how does it feel to look at food all day and be fasting? But surprisingly, it's not an issue. Maybe you get full from the smell, I don't know. But the challenge has been, there's two challenges, one from the employer perspective and an employee perspective. So from the employer perspective, if you have employees who are Muslim, you know, they'd want to take off, you know, sometimes they want to work until 5 and you can't find anyone during dinner time that wants to work, or they're tired, or they just want to take the whole month off. So, and in the restaurant business, it's not an office where, oh, you don't have to come in today, do your work tomorrow. You need people at a certain time all the time. So a challenge is always been the scheduling, you know, talking to the employees and say, I need you during certain days. You know, you kind of have to work. What am I supposed to do? But at the same time, understanding them that, you know, they might get tired or they might need a few days off. So it would have to be like a compromise, you know, come to a conclusion that, okay, you can work these couple days, I'll give you these other days off, but I need you during these times. And, or just for example, having employees just ahead of time knowing, you know, when they can have iftar. You know, in the restaurant business, you can't just stop at sunset and then everyone go inside and eat. So what we typically do is we just put up a list, for example, of if there's 5 people, okay, who goes first, who goes second, who goes last, and we kind of alternate that during the week. Some people prefer to go early, some people prefer to go later. So that's just my advice for people that that deal with Muslim employees that, you know, work after 5 o'clock, after sunset, you know, to handle those situations. So like I said, the challenge is just the scheduling, and that's the busy time of a restaurant. You get a lot of Muslim customers. They want the food, they want their food quickly. So that's always a challenge. And it's usually coincides with the typical dinner rush. So you kind of have two rushes at once. So that's always been a challenge.
Yeah, no, absolutely. Thank you so much for sharing. Next, we'll hear from Dr. Shanawani. How is working as a Muslim in your field impacted during Ramadan in general every year?
I mean, healthcare is a 24-hour operation, and we have to provide care. And I've done a lot of night shifts where I'm both breaking and starting my fast while on duty. And so there's that, people don't stop getting sick just because of Ramadan. A lot of it is advising people on how to take care of themselves. How do you take your medications? There's a lot of people don't like stopping to fast, right? I mean, telling someone that for health reasons that this is a year you're going to have to give up fasting for 30 days, or maybe this is the last year that you're ever going to fast, right, because of age. Honestly, that's the biggest challenge for me. It's working with patients who don't want to give up fasting, or you need to take this medicine at 5 o'clock, but I can't. And then, of course, reminding people that getting an injection, most Muslims agree, doesn't invalidate your fast. So if you're getting an injection like a flu vaccine or a COVID vaccine, a reminder, COVID vaccine doesn't invalidate your CM. Most people agree. And of course, it's a personal conscious decision, but reminding people that there's no there. Don't be a hero in the sense of our God is a forgiving God. Allah's, He's just so forgiving. He is the most forgiving, and He doesn't want our deen, our religion, to be hard on us. But sometimes convincing people that they need to give up their fasting. My dad still wants to fast. He can't do it anymore for health reasons, and so convincing people of that. Telling people to back off their deen when we're so self-judgmental is so difficult. But other than that, I mean, let me tell you, there's always food in the hospital. I can't tell you how many times in my career I've broken my fast on hospital cookies and a hospital turkey sandwich and the apple juice from the pantry. I've done it now. Alhamdulillah, I'm at a point in my career where I don't do too many night shifts, but I still do one. I did one 3 nights ago. So.
Oh, wow. Actually, which made me think when you were saying that about breaking your fast and starting your fast and like having the morning like breakfast meal at the hospital, is that presumably, does that mean you go home and sleep all day? So you're like fasting, sleeping? Is that what that means?
Yeah, I mean, if I'm doing a series of night shifts too, but sometimes I don't have time. Like I worked the night shift Monday night, and I slept for 2 hours Tuesday morning, but then I had to put in a full day at work. Like I said, we're trying to do better with that in healthcare, and it's getting better, but certainly, but yeah, no, there's absolutely some people who they flip their schedule. One disadvantage, by the way, that Hazem kind of touched on is, I got my medical degree in 1997. I'm very proud of the fact that I've worked almost every Christmas for the last 25 years, because it's not my day. It's not an important day. But I'm blessed in that I work in, I mean, I can tell you there's a lot of Muslims in healthcare. And so there's a lot of people that want to take Eid off. But still I'm able to take more often than not, I'm able to take off my holiday. So that's one nice thing about being in healthcare, that when you can get that flexibility, as long as we all agree on when Eid is, which of course everyone on the call knows and everyone on the webinar knows. Some people it's going to say it's Thursday, some people it's going to say it's Wednesday, and that kind of thing. So those are my challenges. I just take the whole week off if I can, and I've been able to do that more years than not. Thank God. Alhamdulillah.
Yeah, no, it just reminds me, I know a lot of college students, not when I was a college student, I would never do this, never. But I know some college students would just like sleep in until God knows what time, and then like stay up all night, and like the restaurants that are Muslim owned stay open until like 3 a.m. So of course, again, I would never do such a thing.
So in Dearborn, Michigan, that's what happens.
Yeah.
To be honest with you, I mean, I mean, let me tell you, being in a Muslim majority, or Muslim, a large Muslim community, like Patterson, New Jersey, or Dearborn, Michigan, or San Francisco Bay Area, where there's a lot of Muslims. Let me tell you, Ramadan is fun, right? I mean, going after iftar to Michigan into Dearborn, you can party like a rock star.
Yeah.
And again, that was something that was unfortunately stolen from us last year from COVID. Things are getting better, but you need to be careful. Sure. You really do need, let's not, I mean, numbers are going up. We need to be careful. Let's not get too excited during Ramadan this year, and lose all of the good work that we did, because we're not out of the woods.
Absolutely.
But I absolutely believe if everyone gets vaccinated, God willing, inshallah, by Hajj time, by Eid al-Adha, really, I mean, I don't want to promise anything, but I'm very optimistic, God willing, inshallah,
Absolutely.
that
Thank you
that
so much.
it won't be like previous years, but it's going to be better than it was last year.
Yeah.
I really believe that. God willing, inshallah.
No, inshallah. Thank you so much for the reminder again about being careful. Lieutenant Shamsab, how is working as a Muslim in your field impacted by Ramadan every year?
Well, like the doctor mentioned, I live in San Francisco Bay Area, and it is a good place to be when you're fasting. If you're Muslim, restaurants are open till 3, 4 in the morning during Ramadan, which is not typical. We actually look forward to it, to be honest with you. I look forward to it. I see friends that I haven't seen that I usually don't see all year. During Ramadan, we break fast together, so it's a good time. It's a great time. And you know, most of my friends look forward to it. I think going back to working the night shift, that it depends on what shift you work. Some shifts are easier to, to deal with than others. I've had to work the night shift during it. I had to work the day shift. A few years ago, I realized kind of just fasting helped me out. I used to have acid reflux and stuff, so
Oh,
I realized it helped with that. So and now I essentially don't eat throughout the day anyway. I try not to eat. The one thing that it does affect is I like to have my coffee. It keeps me on alert. Being a first responder, you have to be mentally alert, and so you realize that you're not as alert when you don't have that cup of coffee.
very true. Yeah, the caffeine withdrawal, I think like we can give up the food, we can give up the water, but the caffeine, ooh, that is difficult, I think, for
Absolutely.
for a lot of Muslims. Yeah, no, absolutely. Thank you all so much, yeah, for just your everyday experiences. So based off of your experience fasting last year during COVID and managing your role as an essential worker during Ramadan, what challenges do you foresee this year, if any? And this time we'll start with Dr. Shanawani.
I think the biggest fear that I have is I think people think that it's over. I think people think that the COVID pandemic is over, and it's not. And I think there is. It's certainly not as bad as last year, but we are seeing numbers go up, and if we're not careful, we could lose all the ground that we did. And I think we just want to be. I think people are tired. They're exhausted. We've talked about the mental health issue. I really believe that the best thing we can do is as we go into Ramadan is just remember, one more year of one more month of patience. I mean, right, Ramadan is about patience, right? It's about wait, right. I mean, you can't wait 20 minutes to get a candy bar, but
Yeah.
here we wait 8, 10, 12 hours before
Yeah.
we eat a meal. If we take that lesson of patience, God willing, and we're supposed to remember what it is that's going out. And there's still, unemployment's high. People are having problems working. Brother Hazim was really mentioning, the challenges of the work environment. I really believe things are going to get better soon. I just don't want us to party too early,
Yeah.
if you will. And right, we know the story of Uhud when the Prophet's companions they jumped the gun and people died as a result back then. And this is no different. If we're not careful with COVID, I don't want to see my ICU fill up like it did last March. I just none of us want to deal with that.
Absolutely. No, thank you so much for that reminder. And again, like the point of today's conversation, because as I'm sure you all know, everyone in the audience, that this is one webinar in a series. But today we're focusing on essential workers and how we can support essential workers. And one of those ways is to be very careful, because if you want to support people and professionals in the healthcare industry, right, like as Dr. Shanawani is so like kind to share with us his experience and how difficult it is to see doctors and nurses, his fellow coworkers, like crying and dealing with the trauma of watching people die. If you want to support essential workers, then one of the things we can all do is be very careful going into Ramadan, to make sure that we don't jump back the numbers in COVID. So thank you again for that very important reminder. Lieutenant Shansab as well. So do you experience or expect to have any challenges this year as well?
I think overall it'll be a better year than last year. I think last year on a personal level and on a work level, it was a pretty bad year where people didn't get together with their families and friends in Ramadan, and Even at work, we were on an emergency deployment schedule essentially the whole year,
Mm.
where everybody had to be on with their phone ready to come back to work when they were needed. We just went back to normal schedules a couple of weeks ago, so we also, just like the doctor doesn't want to see the ICUs filled
Yeah.
up, we also want to go back to an emergency deployment schedule where everything changes and you pretty much have to be ready to work at any time. So I think the doctor sent out a good message where we still need to be careful, but I think it'll be a little better than last year where we can still see our parents maybe a little more, see our friends a little bit more now that people have been vaccinated.
Absolutely. And I think also from my own perspective, what will help is that last year Ramadan was like right at the beginning. We had just all been sheltering in place. The tech, not like the mosques hadn't figured out the tech on how to like get programs up. Right now, we've all been practicing. We've been doing all of our programs, our weekly programs, and so on. We've had like practice time to get used to all of this. So even with doing virtual programming, it's not like the shock factor maybe isn't there as much. So maybe hopefully inshallah that will help out with things as well. Hazem, for you as well, what challenges do you foresee this Ramadan?
The doctor and lieutenant put things very well. Just to be patient, continue, wearing masks. You have people that think that are still, things are back to normal, but a fourth wave is on, hopefully not on the horizon, but it might happen. I hope it doesn't. But I do think it is getting better. People are just more comfortable. They're just not afraid anymore. Like I mentioned before, is this when customers would fight when somebody would stand next to them, and it's not a deal. You can go move somewhere else. But it just that, people being tense. That still happens, but it's a little less than before. But what I noticed, that Ramadan is less than 2 weeks away, is a lot of Muslim organizations or even other organizations are contacting us saying they want to donate food to the poor, to the needy, to the homeless. So we're getting a lot of requests. The mosques would like to provide our local mosque would like to provide meals for like 300 families every day.
Wow.
So they're asking several restaurants in the area to take a week, to take a few days, and would obviously charge them a discounted rate and prepare the meals. We had other organizations recently give food to the homeless. There was a cold snap last month, and an organization contacted us. They wanted 400 meals at 11 a.m. to pass out to the homeless people, Muslim or non-Muslim. So you just notice a lot of generosity. So people are thinking of others.
Yeah.
That's one bright spot during this COVID time, is that you are thinking of your neighbors, you're thinking of the unfortunate, you're thinking of the sick. So and I see that continuing, because people are always going to have this in the back of their head, is we don't want to get back to where we were before. So we just have to take care of our neighbors, take care of the elderly, take care of the poor, and obviously one way of doing that in our business is providing them food. That's the best way, the immediate way to take care of them. So
Yeah.
So there's a bright spot, that during this period.
Yeah, no, absolutely. And honestly, what I'm getting from all of what you guys are saying is that rather than focus on what we've lost from not being able to participate in Ramadan together as we normally do, just for these couple of years when we're not, how are we still able to practice the true values of Ramadan? Dr. Shanawani and Lieutenant Shansab, more about like the self-discipline of, the difficulty of fasting is, making sure you're controlling your irritability, your hangriness, right? Or wanting to, spend time with loved ones in this case for COVID, but it's not safe. This is like one of the lessons of Ramadan is self-discipline. And then also with Hazem, like the idea of charity, right? Like how can you like support Muslim businesses, in this case, restaurants, right? So you're making sure that they're able to continue and run their business, supporting them. But then also giving in charity to those who are less fortunate. So like, where can we look for the values of Ramadan that we can continue to practice in COVID times and through the pandemic, and not necessarily only focusing on what we've lost? That's something I'm definitely taking away from all of your guys' comments. So thank you for myself personally. I hope for our audience as well. I'm sure they've taken away a lot of really great lessons of what we've already discussed so far. Follow-up question for you all. What can your non-Muslim colleagues do to support you during Ramadan this year? And we can start with Lieutenant Shamsab this time.
Well, I think respect and understanding, gaining understanding of why Muslims do what they do during this holy month, and the reasoning for it, and how they feel about it. I mean, there's not much physically they can do for you, but as long as they get an understanding and respect the religion and respect the reason you do it, and support it in whatever way they can, and that's really all that I think any Muslim would have.
Absolutely, thank you. Hazem, can you follow up with what can your non-Muslim colleagues do to support you during Ramadan this year? And of course, I know you're a business owner, so make of what you will from that question.
Yeah. Just to continue supporting their local business, their local restaurants. I advise the people just to be patient. Like I mentioned before, it's difficult to schedule. So if you go to a place on a Saturday night at 6 p.m., 7 p.m., that's the busy time of a restaurant. So you have to wait an extra few minutes just to be understanding. A lot of times what people do, they take out their phone, take a picture, write a review right away, and just show their disappointment. And, I look at reviews as kind of like a report card. Most of the time there's some legitimate concern or a good compliment. But I just urge people just to, if there's an issue, just ask the manager, just if there's an issue to take care of it, we'll take care of it for you right away. And just be patient, and, and just don't write just a bad review on a business if you see them working hard or they're trying their best. Is just understand the situation. People are not as patient as they used to be. Now waiting 15 minutes for food is like considered a lifetime. Whereas before you tell people half an hour and say, okay.
Yeah.
But not anymore. So unfortunately, that's what we have to deal with in the business industry. So like I said, the key thing, just be patient and support your local business.
Absolutely. No, thank you so much for that reminder to be patient and kind and give grace to those, especially those in essential worker roles. Dr. Shanawani, for you as well, the same question.
Honestly, to my non-Muslim friends, for those that are watching today, the only thing I want is just wish me a happy Ramadan. And if you're celebrating Passover, save me a macaroon. And if you're celebrating Easter, save me some chocolate eggs, because I think about ING, and I think about Lieutenant Yusuf and Brother Hazem here. The one thing that we all have in America, we're not from the same country, we're not the same religion, but we all have a love of liberty and freedom and the pursuit of happiness. And that's what we're all about. And groups like yours, truth be told, with ING, I mean, it's really about meeting those. And we live in a really awesome country where we get to celebrate each other's religions, right? I mean, my neighbors and my friends are celebrating Passover, and this weekend is Good Friday and Easter, and right. I mean, it's awesome, and that's great. And I want my chocolate macaroon for Passover. I love those. And honestly, if all they do is save me a macaroon and wish me happy Ramadan, I've got one friend in particular in Florida, a colleague, Dr. Alex, whose wife makes the most incredible macaroons on the planet. And when he used to work together with me in Michigan, she would give me some. And unfortunately, I miss those macaroons. But, like I said, just wish me happy Ramadan. And then, hopefully let's get a hot dog together over Memorial Day or the 4th of July. We live in one of the best places in the world because of that, because I can celebrate my day and you can celebrate yours. And that's just, thank God for that.
Thank God. Absolutely. Yeah. And so moving to the institutional level then, so before we're talking interpersonally, now institutionally, what can your institutions do to support you or Muslim employees during the month of Ramadan? And Hazem, if you could start with us this time.
One from two different perspectives. For example, for the employee just to be loyal to their employer, be understanding, and for the employer to be kind to their employee and understand their position. So I think it's key to have a clear understanding of what's expected during Ramadan, and to schedule accordingly to accommodate anyone's wishes in terms of taking off, leaving early. And be understanding and clear up front, as opposed to having an argument during iftar time on what happens during that time. So that's kind of the only thing I can recommend.
Yeah.
When you do that ahead of time, things are just so much smoother during the whole month. So that just makes everyone's job more comfortable when you know what to expect.
Absolutely. Yeah, and absolutely. And I imagine like trying to put in if you need accommodations or time off to like try and put it in ahead of time. You know when Ramadan is going to come. So let your employer know ahead of time instead of waiting to like the day before it starts. Dr. Shanawani, for you as well, what can, institutions in healthcare do to support employees, not just necessarily doctors and nurses, but all employees that are Muslim?
One of the other things that 2020 has taught us is that not taking care of minority groups is itself a threat to health. Right?
Mm,
You're hearing people talk that racism is a public health crisis. I work for a company here in Michigan. I'm very proud of the company that I work for, their commitment to inclusion and diversity, and they bring in organizations like yours, like ING, actually, that really teach us about the diversity of all of the people that serve. And to that end, they're incredibly accommodating when I need a place to pray or to
mm,
take time off on Friday and disappear. All of those things that they do to accommodate just my practice of my faith every day. Really, it doesn't get better than that. Last week was my birthday. They sent me sandwiches. Just we couldn't celebrate together like for a cake, but they made sure that the food that I eat is halal and allowable within the dietary restrictions of my faith. That honestly is the biggest thing that they can do, as well as continuing to the commitment of, like I said, health isn't just not having disease. It's
yeah.
social, physical, spiritual, mental
Mm,
health, all of those things. If you don't have all of those things, you're not healthy. I work for a health company that is committed to all of those things. I wish everyone was like that. And
mhm,
as I think about hospitals and payers and everyone that takes care of health, having a good meal is healthy.
mm,
Feeling safe in your community is healthy. Those are things, and that's something that the company I work for is very committed to. Truth be told, I have nothing to ask other. Like I said, just wish me happy Ramadan and save my
yeah, yeah,
macaroon. I want my macaroon. That's my
yeah.
only complaint this year. I didn't get that. God knows I don't need one, but
Yeah. Absolutely. Well, happy birthday, Dr. Shanway. That's super cool. Lieutenant Shamsab, how can law enforcement institutions support their Muslim employees?
Well, for my organization, I'm currently the only Muslim here. But I think with organizations where there's more Muslims, I think, kind of sending a message out, kind of wishing them happy Ramadan, I think would go a long way. And also think, like the doctor said, having organizations come in and provide some type of training, like you guys did for us. We had you guys come, the ING group, come out and train our
Yeah.
organization a few months ago. I think our people, our employees took a lot from that, not only for the employees within the organization, but I think that helps in dealing with people in the community. We have a big Muslim population here in the East Bay, in the San Francisco Bay Area. We have a mosque here. We have halal restaurants here. So I think, focusing in on that training, more focusing towards, why don't Muslims eat? Why do they fast
Yeah.
during Ramadan? All those things that there's so much idiosyncrasies to the religion that I think we could talk about, and it could take hours. It could take an hour, depending on how you guys organize the training. I think it could go a long way in helping our organizations gain an understanding, not only for the employees but the public that they serve.
Awesome. Awesome. Thank you all so much for sharing all of your answers, your personal experiences, and your wisdom. Next, we are going to transition to Q&A from the audience, some of our favorite parts of the webinars. So one question to get us started. So anyone watching on Facebook Live or here with us on Zoom internally, if you've been holding on to any questions so far, if anything has come up for you that you want to ask the panelists, I invite you now in your respective either Facebook comment section or here on Zoom to submit your questions. It can be something to all of the panelists, one of them, two of them, whichever, whatever you prefer. So with that, we did have a question come in. This is for everyone. So what is your favorite way to break your fast during Ramadan? And then we could just do popcorn, anyone who'd like to answer first.
I guess I can go first. I like to get a little workout in before I break my fast. I've noticed I can't work out after I break my fast. You don't eat all day, so when you do eat, you just get that food coma. So I like to get a little bit of a workout in, like nothing crazy, probably a quarter of what I usually work out, a quarter and a percentage of it. But 30 minutes before I break my fast, I like to get a workout in.
Nice.
That's how I break.
Very cool. Dr. Shinawani, I think I saw you go to unmute.
Oh no, but I can go. You wouldn't know it from looking at me this year, but I used to work out, and I love what Lieutenant Yusuf used to say. I used to work out right before iftar time. I am very much an extrovert, and the one thing that I really look forward to getting to, maybe not this Ramadan, but in 2021, inshallah, is I love going to those group iftars, especially near on the college campus here. I live in a college town, and there's one where you just, you've got all these kids and grad students, and this is like the only good meal they have because they've been living on ramen the other 11 months of the year, and truth be told, just getting together and eating and praying Maghrib and doing that, and then going back home, that's a ton of fun for me.
It is. It's really special. Hazem, for you, what is your favorite way to break your fast?
My favorite way is probably just have a piece of chocolate. I know we're supposed to eat dates first, but sometimes you want that little sugar that just makes you feel good. So yeah, that's what I like to do.
Yeah, no, absolutely. No, I don't know why, but like I don't really like dates normally, but Ramadan, they're like delicious. And then like after Ramadan, I'm trying to eat the leftover ones and I'm like, oh, I don't care for them anymore. It's magic. So another question that we have for you all, so again, this is for all three panelists. So what is your favorite part about the month of Ramadan? I think we've like touched on different parts that we like. Anything that you would like to add to what we've already discussed?
I guess I can go first. Seems like we're playing that order. I think that like the doctor kind of mentioned earlier, we're pretty blessed to be in this country and have plenty of everything. I wasn't born here, and so sometimes my kids don't appreciate some of the things that they get. So during Ramadan, you really get to appreciate just the simple bread, the piece of bread that you eat, because you don't eat all day and you get so hungry, or you don't drink water all day, you get so thirsty. It really you gain an understanding of how blessed you really are during that month that you kind of sometimes forget throughout the year. So I think for me, that's kind of the most my favorite part of it.
I guess I'll go next. My favorite part is knowing that everyone is eating at the exact same time. It just feels good seeing everyone. Obviously, there's some people that you don't see, but you just see in Ramadan. So you go the whole year and you're like, I haven't seen you in like months and months, and then you see them often in Ramadan. Whether it'll be at an iftar or you go to Taraweeh prayer, the extra night, and then the feeling of completing a prayer, your 8 rakahs or 20 rakahs or whatever, and then just that feeling of relaxing and just seeing everyone after iftar and after Taraweeh. This feeling that you accomplished something, you completed your day and successfully, inshallah, and that is something that feels good that you don't get that feeling during the rest of the year.
Yeah.
So that's my favorite part.
Absolutely.
For me, I will say one of my favorite parts of Ramadan is actually also one of the toughest parts of Ramadan for me, which is for me, the eating and the drinking part. I mean, that's tough, but that physical aspect of the fast is honestly not the most challenging for me. Although I will tell you, those first 3 days of caffeine withdrawal that you touched on, those are painful. There's really no ways about that. But even that, I mean, truth be told, for me, it's a special month, knowing that it's a special time, and doing those other things where I'm focused not only on the not eating and drinking, but being patient, maybe watching my tongue, avoiding certain words that I probably should be avoiding the other 11 months of the year, but taking extra time to do those things. Not getting mad at the guy that just cut me off on the highway. I know the traffic here isn't as bad, Lieutenant Yusuf, I imagine not a lot of people cut you off when you're in a squad car, so you probably aren't familiar with this. But those of us that drive civilian vehicles, like, getting cut off, just remembering it in Ramadan. And, Brother Hazem was talking about trying to be patient and understanding and just walking a mile in people's shoes. I mean, it's that true. It's you hear people talking about mindfulness all the time, and it's 1 month where I really feel like I just need to do that if I don't do anything else. I wish I had the iman and the willpower to do it the other 11 months of the year, but there's just something about the sacredness and all of the shayateen being locked up for 30 days that just makes it easier for me to do it for those days. That's my favorite part.
I agree. There is something about the air in Ramadan. It's different.
That's exactly
something
it.
is different. I don't know what it is, but I totally am there with you. Okay, awesome. So now we're going to get into our closing question. We are just at that time. So very briefly, if you guys could just do like a quick statement, what are the ways the public, Muslim and non-Muslim, can support essential workers in your field as we wait out the remainder of COVID-19? And if we could start with Hazem this time.
Just like as I mentioned before, just continue supporting your local businesses, especially the small businesses that need your help. That a few orders a day in terms of the restaurant business can help out a lot. Try to order catering, small catering orders from them. That helps out tremendously as well. Order ahead of time. And I keep saying this again, just be patient. And like the doctor mentioned, just walk a mile in other people's shoes, understand the other side, when something that you think dislike happens, just be understanding and accommodating. So,
absolutely.
Yeah.
Thank you. Lieutenant Shansab, could you finish also? What can the public do to support essential workers in law enforcement?
I think patience and understanding. I think it is going to get better. It is getting better. Last year, we've had to change some things organizationally, how we responded to calls, not responding to certain calls, being at safety and staffing minimums. So sometimes it just takes a little bit of an explanation to explain to people why the reason you don't respond to a parking complaint or something like that. There's more priority calls. Yeah, during COVID-19, I think just patience.
Absolutely. Thank you. And very appropriate for Ramadan, I think. Dr. Shanawani, if you can close this out.
If you're going to see Yusuf or Hazem next month, do it with a mask on and from 6 feet away, so that way you don't have to see me next month. I mean, that's really it. And the only way, I want to see you for one of two reasons next month, because we're going to see each other from 6 feet away at the mosque, or because you're coming with your sleeve up to get your shot. Get your shot, be safe, wear your mask, social distance. Better days are coming. It's never going to be like it was before COVID, but we will get back to something that feels more normal. Inshallah, be patient with yourself, with other people, and just remember that God loves you. And just it's the best month of the year, and it's coming in a few days. And like you said, you put it. No one says it better than what you said. Let's think about the things that we're getting.
Yeah.
Because a lot of people aren't here with us this year for Ramadan. Let's remember them. We lost them. And let's thank God that we got to see another one. And let's pray that we see another one in a year.
Absolutely. Thank you all so much for this amazing, great discussion. While I am sure, as you guys have all seen in our audience, we could go on for a very long time. But I wanted to be mindful of our panelists' time and then also of our audience. So before we formally close out, let me just share some exciting upcoming events and resources with everyone. Let me share screen. Go ahead. Awesome. So in the chat in the comments in Facebook and in the Zoom chat right now, there will be these links to hand out resources on supporting Muslim essential workers during Ramadan, one for employers and one for Muslim employees. So make sure to check those out. The ING, the Organization Islamic Networks Group, bringing you today's webinar, has many different resources on Ramadan and related topics. This includes free presentations on Ramadan, how to support your employees, to have interfaith discussions around Ramadan, and so on. We have digital presentations on fasting, on Muslim Americans and their faith. You know, there are calendars of Islamic dates, whether if you are a school or again an interfaith community, some employers that you want to be sensitive to the religious dates of your Muslim employees. These are all really great resources. And my personal favorite is our FAQ list of answers. That is a very exhaustive list, very, very cool. I highly recommend checking that one out. And then lastly, tomorrow, as I mentioned earlier on, and as I'm sure everyone already knew, this is one webinar in a series of webinars on Ramadan and supporting different communities within the Muslim American community. And so tomorrow's webinar will be Thursday, April 1st, between 4 to 5 p.m. Pacific Standard Time. And it will be on Ramadan inclusion, how educators can accommodate their Muslim students during the spiritual season, where we will hear from educators themselves and get tools. If you have any comments or questions, we encourage you to message ING at mail@ing.org. And with that, I will thank all of our panelists again so much for sharing all of your personal experiences and your wisdom. And thank you to our audience. And with that, I will say Assalamu alaikum, peace be with you all, and may you all have a wonderful Ramadan.